ACL surgery has made several advancements over the 20 years. First one is the clinical outcomes. In the late 90s, an ACL surgery was a career-threatening injury. Since then, now many athletes tear their ACL, and now our expectation is return to sport, and really return to sport at or above the level that you were before. Some of this is due to the way we do the surgery. Now we do what's called anatomic tunnels. Essentially, we're able, because of instrumentation, we're able to put the ACL graft exactly where it's supposed to be, on the origin, on the femur, and insertion on the tibia. Before we weren't able to do that. So by making the ACL anatomic, we're getting better outcomes. Obviously, there's also been advancements in physical therapy, even bracing, that has contributed. Another major advancement is now we're looking at ACL repairs in a subset of patients who have ligament tears off the femur, and mostly the entirety of the ligament is still intact. We're able to actually repair those to the femur. And over the last several years, we've been getting good outcomes with that. Before, essentially, we always did a reconstruction, meaning that we use graft either from the patient themselves or donated graft to reconstruct the ligament. ACL surgery is not just important for athletes, but it's also important for the everyday person. We often see ACL tears and twisting injuries when even walking down the street, or slips and falls, or car accidents. The ACL is a ligament that's crucial for stability of the knee. And in these patients, we also get excellent outcomes, and we get patients back to doing all their activities. If you have an ACL tear and are considering surgery, please call Active Orthopedics. We have many specialists who can help you in the decision-making process and give you all the appropriate options and answer all of your questions.